Health and Human Services Secretary RFK Jr. has been promising a report looking into the causes of autism. According to the Wall Street Journal, the report's expected to highlight two possible links to autism. One is prenatal use of Tylenol, and the other is low folate levels during pregnancy. Autism affects about 1 in 30 children in the United States, according to the most recent data.
And these numbers have increased in recent decades in terms of autism diagnoses, but in many cases can be attributed in part to better diagnoses of autism. At the same time, they've been trying to figure out the causes here. And that's something that RFK has been talking about for months. So the latest potential links here in this Wall Street Journal report, they may try to draw a line here between Tylenol and autism, is especially significant, Jill, because Tylenol is one of the few things doctors say is okay for women to take while they're pregnant. Now, as far as the certainty here that this will be in the report, well, the FDA Commissioner, Marty Makary, a close ally of RFK, he tried to tamp down the uproar late last week, saying we're still in discussions here about what this report is going to entail. At the same time, the science is far from settled when you look at some of the major studies that are out there. And of course, we expect this report to just basically be a review of the existing studies, because again, there hasn't been enough time to conduct a new study here. Now, recently, there was a Harvard analysis of 46 studies related to Tylenol and autism with 100,000 participants. So it was a study of studies, of 46 studies, and they found what they call an association between Tylenol, its use during pregnancy, and a higher risk of autism and ADHD. Now, while they saw an association, they did not see causation. And as we all know in research, correlation is not causation. Just because two things are going up at the same time or going down at the same time, or as something goes up, the other thing goes down, doesn't mean they're linked. Drawing a causation, that requires much more work, much more research. One of the issues they face right now, Jill, is they haven't figured out details on the amount of Tylenol, what stage of pregnancy the Tylenol is taken, age of the mother, other pre-existing conditions that mother might have, and other sort of circumstances that may exist related to autism there. So the researchers in that Harvard report called for cautious, time-limited use of acetaminophen during pregnancy under medical supervision in the meantime. And they said that clinical guidelines need to be updated to better balance the benefits and risks, but they called for more research into the matter. At the same time, there was a separate study done out of Sweden that came out in 2024. This is cited a lot, following 2 million children, and they found no link between autism and Tylenol. They instead suggested genetics or other factors may be at play here. Now, the American College of Obstetricians and Gynecologists recommend that pregnant women consult their doctors before they use Tylenol, as they recommend with all medicines.